Hello, good evening, everybody. Welcome to our Tuesday evening, our technical evening, where we talk about the more technical aspects of nutrition and how it affects us and what difference it actually makes in our system. And last week we started talking about that structure that holds our body together, namely the skeleton or the bones, because if we don't have a decent bone structure, it's like trying to keep a tent up on, let's say, like inflatable poles. Probably not going to work so well. If you've ever been inside a circus tent, you look at the size of their poles. Imagine if those poles were made out of thin little reeds. Do you really think it would be able to hold up that very good big tent? And if it did, how long would it stay up? I don't think it's going to stay up very long. So it's important to have really good, strong poles to hold up your tent. And the same goes with our body. If our skeleton is not strong, it's not going to hold our body up so well. Yes, we can move around because the body is different to a normal structure. And quite honestly, I'm always surprised at how well our body survives all the abuse that we do to it on a daily basis. You think about the food or food-like things that we put into ourselves and the toxins that we expose ourselves to and the stresses that we expose ourselves to with running and walking and climbing and jumping off things. Maybe not everybody on this screen, but there are a few that will be watching this recording later who do things like jumping off bridges, jumping off horses, strange things like that, yet we survive. And our bodies are actually a lot tougher than what we realize. But if there is a weakness in the skeleton, we are going to suffer, and I am going to get business. And sadly, I see this way too often. And what really, I don't know if it scares me or just upsets me, is when I see young children of about 5, 6, even 10, who were playing in the playground and were pushed and fell and broke a bone. And we're not talking from a height, we're talking literally somebody ran, they pushed them over and they fell down and they broke their arm. That shouldn't be happening because a child's skeleton should be flexible and it should be strong enough to withstand that. If they get caught in like a tree branch and like a lever arm type stress is put on there, yes, I can understand it. But the snap of a bone just by falling over on grass or sand, in my opinion, shouldn't happen. And sadly, unfortunately, the older we get, the less we bounce, and therefore we do shatter a little bit more easily. But even so, our bones should still be able to handle a fair amount of stresses before they snap or break. And as we learned last week, we do need to have things to strengthen our bones, but there's a difference between strengthening your bone and having it brittle. If you take a tree, for instance, it can generally, a young, healthy tree will generally stand up to quite a hefty wind. But if that branch loses nutrients and becomes brittle, it snaps. And I had a patient recently who had been up a ladder cutting a tree because one of the branches had broken and they were cutting this tree. What they didn't realize is that the inside of the tree was rotten. And as they cut through the branch, it snapped or sort of exploded. And, well, gravity took over and he's now in hospital. But our bones do a similar thing. We don't always see the rot in the bone until it snaps and breaks. And then you see where all the problems are. So I'm going to take up where I left off last week, and we started talking about osteoporosis. And let's get up to my goodies over here. Some other pictures over here. And I'm borrowing this from the website called Food, A Fact of Life, which is a university website from the from the UK. And I borrowed part of this talk from them, and I've mixed in a few others as well. And we're talking about bone health through life. And we went through the early stages of life, and we went through the vitamin D and the calcium and various things that help to keep your bones strong and flexible. Now we're getting to osteoporosis. In this little graphic over here, you will see 4 stages of bone health. The first one, cursor over there, this first one, if you cut through healthy bone, which is what this neck of the femur, just by the way, there's the body of the femur, there's the neck, and there's the head of the femur. So this is usually the weak spot in your body. So if they're ever doing a bone density test on you, they will take an X-ray of this section here. So they'll take an X-ray of this section here and also your lower spine. Check and see how dense your bone is. Now, if you cut through healthy bone, it should look like the inside of a crunchy chocolate. If you've ever broken a crunchy chocolate, those are the ones with the golden honeycomb on the inside and the chocolate on the outside. That is what healthy bone should look like. If you break through or cut through unhealthy bone or osteoporotic bone, it will look like the one on the very far right-hand side, this one over here. And it looks like the inside of an Aero chocolate. And if you are wanting to indulge and check out the 2 differences, you will see that the bubbles inside an Aero chocolate are significantly bigger and they break a lot more easily than the bubbles in a crunchy chocolate. And that is what happens with osteoporosis. And as we learned last week, we are starting to lose bone density from about the age of 25 onwards. So your bone, while it is always regenerating, is not regenerating quite as fast as it does before you are 25. As a person gets older, some loss of calcium from bone is normal, but severe loss results in gaps in the structure of bone. And we're talking a lot of the time over here, ladies especially, specifically ladies who are either pregnant or have given birth to babies. That little baby is a sucker, and that little baby has a skeleton that needs to grow, and that skeleton needs calcium. And if it's not getting calcium from the mom's diet, it's going to get it from the mom's bank. And her bank happens to be her skeleton. So ladies who are pregnant or who have had babies and are not regenerating their calcium intake, and you're probably not going to get sufficient from your diet, you will almost definitely need to supplement. You are going to you are going to have osteoporosis at some stage. And it usually becomes apparent from your 50s or menopause onwards, where you tend to start losing a lot more minerals as well from that age onwards. And that's where the problems come about. And as I often say to people, I will see elderly ladies and come into hospital and they've got a fractured femur. And say to them, what happened? Oh, no, I was in the bathroom, or I was in the garden, or I was in the kitchen, and I turned suddenly, I stumbled and I fell. As I turned, I heard it, and I fell, and I broke my hip. And quite often, and it's virtually impossible to actually tell exactly, quite often what happens is when they turn, that stress is enough to fracture the neck of the femur. That is what causes the fall, not the other way around. So when we get older, we have severe loss, which results in gaps in the structure of the bone. And this causes the bones to become weak, brittle, and to break easily. Now, there is a medical condition called brittle bone disease. It's I think it's called osteogenesis imperfecta, it's a fancy medical term for it, but it's commonly known as brittle bone disease, and that can hit at any age and quite often is genetic, and there's not too much that one can do. And you see these little babies, and mom goes to pick them up to change their nappy, and they end up breaking 2 or 3 bones. It's a horrible thing and very, very painful. And unfortunately, not too much anybody can do about it. But the majority of people don't have this. It's a relatively rare disease or condition. So be grateful if you don't have it. And the condition that we are aware of in adulthood, where your bones are weak, brittle, and break easily, is known as osteoporosis. Osteo meaning bone, porosis meaning porous or holy, basically. All bones can be affected by osteoporosis, but fractures are most common in the wrist, the back, which is your lower spine, and your hip, which is usually the neck of the femur. Osteoporosis most frequently affects older women who have gone through menopause, but it can affect men and younger women. And according to Dr. Barry Bland, everybody can and will get osteoporosis at some stage. And I worked with an orthopedic surgeon at one stage who told a family member of a patient who had asked the question of how can I go, what can I do to prevent having to have a joint replacement? And this particular surgeon, a very dull sense of humor, and he looked at him with a straight face and he said, "You die." And the family member nearly died on the spot. And he went, "What do you mean?" And he said, "It's not a case of if you will need a joint replacement, it's a case of when you will need a joint replacement, because your joints, because they're being used regularly, will wear out. Whether you need a joint replacement at 60, 80, 120, or 25, depends on a lot of factors. But at some stage, you will, unless you die first, need a joint replacement. So again, what is osteoporosis? This is what your bone looks like under an electron microscope. And if you look on the left, that is what healthy bone looks like. Quite an interesting little structure. And on the right is this very weak, brittle, sensitive structure. And that is what osteoporotic bone looks like. Now, bones are fragile and more likely to break. Or bones that are fragile are more likely to break. And this little X-ray on the left-hand side is a classic example of somebody who probably fell either down a step or motorbike or out of a tree or etc. because they've done a really good job on their forearm. A fragility or stress fracture is a broken bone as a result of minimal trauma. And this is often found in runners. I get them quite often, more specifically ladies, if they are doing a lot of running and they're either using incorrect shoes or they don't have sufficient minerals in their system, they suddenly develop this pain in their foot for no reason. And most times they will run through it because, oh no, I was just running a little bit too hard, and they keep going. Until the pain gets so bad that they go and see a doctor, you press an X-ray and you see what looks like, if you've ever looked at a china cup that has got those little fine cracks in them, that is what a stress fracture looks like. And sometimes it requires a CT scan or an MRI scan to show the fracture. But any time that there is a crack in a bone, it is known as a fracture. I do have patients who tell me gleefully at times that, thank heavens, my bone is not fractured, it was just broken, or the other way around. Thank heavens, I didn't fracture my bone, or I didn't break my bone, I just fractured it. And they don't realize it's the same thing. Medical people are confusing people. So fractures can lead to pain. And interestingly enough, some people don't actually have pain when they break a bone. I don't know why. And they also lead to changes in body shape and disability. So if You have a fracture like this little picture to the left over here that is not set correctly. Anytime that two bones join, they will heal. Whether it's at that angle, or completely twisted, if the bones are touching, they will grow together. That is why it's so important to have somebody realign them and get them to set correctly, because then there's a lot less disability later on. Weight-bearing activities such as walking reduces the risk of osteoporosis. So they'll often tell you, go and do weightlifting. We're not talking going to the gym and lifting your body weight in metal weights. We're talking lifting 500 grams or 1 kilo weight. And if you don't have a 1 kilo weight, get a 1 liter bottle of water and lift that. That is 1 kilogram. Just walking, I've always said it. Park as far away from the entrance to the mall as possible and walk. Come and join us at Park Walk or Park Run. Let's go for a walk around the block. But that little bit of weight-bearing exercise makes all the difference. And in fact, the generally accepted protocol with a broken bone, specifically an ankle fracture, as long as the alignment is correct, generally a patient is kept non-weight-bearing for the first 2 weeks after the fracture. And thereafter, they're put into a boot and they're told, put some weight on that foot, because that not only stimulates the bone, but it starts to strengthen the bone as well. Now, the complete healing period is anything between 6 to 8 weeks. There are different factors as to why I say 6 to 8 weeks. But at around 6 weeks, roughly, your bone is healed. And that's what I call the wet putty stage. So the bone is there, but it's not particularly strong. So if you happen to stumble and fall again, you can pull it apart. And by week 8, that bone has knitted sufficiently well that it is like a weld, metal weld, and short of a baseball bat on the exact spot of the fracture. You will not fracture that bone again in that exact spot. Maybe a little bit above or a little bit below, but not right on the spot, because it heals and it reinforces, even an osteoporotic bone. Exercise during childhood and adolescence helps to strengthen developing bones. And this is why it's so important that kids get outside and play. And I always tell people, let your child be a child. Let them go and climb trees. Let them go and climb jungle gyms. Let them run. Let them tumble, because that helps with their balance and helps to strengthen those little developing bones. Regular exercise throughout life is also important to keep bones strong. Generally at school, pretty much everybody plays sport. But as soon as you leave school, most people then quit most of the exercise that they were doing. I don't know why it is. Maybe at varsity or college, they will continue to play sport to a certain extent. But in the vast majority of cases, people don't continue with exercise. And then they start with the junk food as well. And particularly drinking a lot of sodas tends to leach calcium out of the bones, which speeds up the osteoporosis. Lack of physical activity results in low bone mass. And again, I've explained this before, but these guys that spend extended amounts of time up in space, in a weightless atmosphere, end up with problems because they lose bone mass while they're up, specifically in places like the space station, etc. And they've got to do quite intensive exercises when they get back to regain that bone mass. Bone loading increases bone mass. So walking, weightlifting, gardening, anything along those lines will go a long way to helping to increase the bone mass. Static weight-bearing exercises can reduce any decline in bone mass and improve bone mass in the over 70s. I know everybody on this call is still very young at heart, but if you're not doing any weightlifting, do yourself a favor, invest in some weights, make your own weights, but start to do some load-bearing or weight-bearing exercises. Your body will thank you for it. high impact exercise in early years increases bone mass. And this is where running comes in. And I was actually reading an article yesterday because there's been this big debate as to marathon running. Is it good for you? Is it bad for you? And they found that in the long term, it actually is good for you. They used to say it wore out your joints a lot quicker and easier. But that apparently is as a result of other factors, not the running. Running, in fact, does help increase your bone mass because of that continual stress when road running. Balance and strengthening exercises will also decrease falls risk. And these are things like Otago or Tai Chi or yoga. Those are all very good balance and strengthening exercises. What are the risk factors for osteoporosis and fractures? One of them is parental hip fracture, which is one of those genetics. Age, race. Some races, unfortunately, tend to have weaker bones than others. Early menopause, gastrointestinal conditions, kidney disease, liver disease, autoimmune disorders, Parkinson's disease, cardiovascular disease, previous fractures, and it's usually things like stress fractures, that kind of thing. I wouldn't include things like a car accident, for instance. Dementia is another one, and cancer. Steroids can cause problems. Antidepressants, anticonvulsants, aromatase inhibitors, which is more the medical side of things, prostate cancer drugs, omeprazole, I'm not too familiar with that drug, a low BMI. So technically, my body structure is at risk of fractures because I've got on the lower end of the BMI scale. Smokers, and a lot of the reason for that is that with the smoking, that tends to decrease your vitamin C in your system, and when you decrease your vitamin C, you lose the collagen in your system, which is why you'll see that long-term smokers have got really bad skin, that's very leathery. Alcoholics as well, similar sort of thing, very leathery skin because the vitamin C has been taken out of their system, and therefore their bones also become weaker. Alcohol, we're talking more than 3.5 units daily, so we really are the same alcoholics. Decreased physical activity, and sadly, today's lifestyle, a lot of people are spending a lot more time sitting on the couch, using a remote, playing on their phone, or their laptop, or their iPad, or whatever. They're not actually, that's where they're getting the exercise. They're exercising their thumb, but not the rest of their body. For a diet, which all goes together with everything else, unfortunately. Time over here. Decreased exposure to sunlight. Again, spending time indoors. There are a number of other factors that are involved in osteoporosis. Smoking and high alcohol intake increase the rate of bone loss and the risk of osteoporosis. And usually, I'm not saying every case, but usually people who do a lot of smoking, who drink heavily, also tend to spend a lot of time in depression because they're sitting inside, stressing about life and how bad life is. You'll quite often find them on a lot of chronic medications. They do not spend a lot of time outside, which leads to or aggravates the depression, in my opinion. And they just, the whole lifestyle and diet is very poor. Osteoporosis is more common in people who are underweight as well. As I said, technically am at that risk. And early menopause increases the risk of osteoporosis. And I think I'm going to end around about here. We've got about 8 minutes left. So before I get into what is suggested from Neolife, does anybody have any questions relating to osteoporosis specifically, as well as the other bone conditions that I have mentioned before I cut this recording? No questions? Right.